why are knee injuries so common?
Because there's not so much stability around it.
Because we use them every day.
We've used
Okay, in other words, simple math, right? The more you use it, more are the chances of getting hurt. You know? Okay. A knee. This is how I learned English. A apple. A knee. A orange. Medial collateral ligament. Lateral collateral ligament. Okay? ACL, PCL. Okay, let's do it this way. So like this is supposedly the knee bone, right? Lateral meniscus, medial meniscus. Okay? Patella, patellar ligament. Make sense so far? In here, a fat pad. Okay. This is the most basic knee that you'll ever see. Okay? When you patellar tendon here too. Okay? People will come to you with injuries to the lateral side of the knee, medial side of the knee, meniscus, very common, ACL, PCL tears are very common. And you can also get people at later stages who will come to you with knee arthritis and patellar it's arthritis under the patella. I forgot the name. Chondromalacia patella. Okay, chondromalacia patella. Okay. Now it depends. In some cases, when you have knee injuries, surgery is necessary, especially if the patient wants to go back to a very active lifestyle. In other cases, it's not necessary. Okay. Most common injuries that you will find in knees are meniscus. Okay. Medial collateral ligament tear or a sprain with meniscus, because this is actually together they're attached. So every time you hurt this side of the body, this side of the knee, most likely meniscus tear will occur to you. Okay. You'll have people that hurt their PCL and ACL. Okay. Now let's kind of review what each one does. What does this do? In which way?
Medial?
Yeah, if there's a force from this side, okay, this keeps the knee from buckling this way. Okay? If there is a force from this side, lateral collateral ligament keeps the knee from buckling this way. If there is a force from front to the back this way, posterior cruciate ligament keeps the knee from going back. If there is a force from the back, anterior cruciate ligament keeps the knee from going forward. okay? Now, what is the purpose of your meniscus? What is meniscus?
Cushioning?
What's it made of?
Cartilage.
Cartilage. Okay, meniscus is like two cups, very shallow cups. Okay, whoever designed us could have done a better job with it. It's a very shallow cup, okay, that actually, put your hands like this. This are femur, okay, this is my femur, and this is the end of the femur, right? They're sitting in those, okay? And the purpose of it is to slide when you bend, and when you stand up, your knee slides in the meniscus, okay? There are grooves that they make the groove, okay? It slides in and out. Okay, so if you don't have meniscus, your knee becomes very unstable. You will see a lot of patients that have their meniscus removed, okay, and their knees are very unstable. Okay, now, in some cases you have to remove the meniscus, okay? Like if you have a bucket handle tear, okay, bucket handle tear is a very severe tear of the meniscus where this part of the meniscus comes and it just lifts like this. So when you sit, you know, and you're trying to get up, okay, part of the bone catches this and you can't, your knee gets locked. Okay, when your knee locks, you know there's a meniscus injury in there, okay? It could be a bucket handle tear, it could be other tears, but there is a meniscus injury. They also have what's called the joint mouse, when a piece of meniscus tears completely and it just floating in the joint. It can go here, there, and it sometimes gets stuck. You can't either open it or you can't bend it, okay? In those cases, obviously the best treatment is they go arthroscopically, they, you know, find the mouse, put a couple of traps, catch them, take it out. Okay, in other words, they remove the meniscus, okay? Piece of the meniscus. Now, people with severe osteoarthritis, they have no meniscus left. Okay, they have no cartilage left, so it's bone on bone, so it's very rough. Okay, those people, when they walk, you'll hear them a mile away. When they sit, you'll hear them a mile away. Every time they move, you'll hear them. Why? Because there's a lot of crepitus in the joint. Same thing goes on with people that have condromalacia patella. Their knees are very noisy. Okay, and when you actually palpate the patella, it's very uneven. It's just, let's say this is a patella from the side, right? It's supposed to be smooth like this. In their case, you know, it'll be like bumpy. Inside is really bad. You know, it just grinds. Now, the treatment for this is to regrind the patella. You literally want the bone to resurface it, re-smooth it. Okay? It takes some time, but it works.